Hello everyone, my name is John. Welcome back to the channel. Now I want you to imagine this. So it's the first day of school and you walk into the classroom and there's a paper on your desk and you read the paper and the principal has implemented a new rule. So for the entire year, you are going to get to determine your own homework. Not only that, you're going to get to grade your own tests and decide whether or not you passed. And if that wasn't good enough, the teacher never knows any of your work. How would that work for you? That's exactly what's happening with the GRAS loophole. The companies themselves get to determine whether or not a food additive, a chemical that they're putting in the food chain, is safe or not. They themselves get to determine that. And the FDA, the people who are supposed to be regulating our food supply, never know the chemical is added. The companies themselves decided, and tomorrow it's on your grocery store shelves, and the FDA never knows anything about it. Sounds insane, right? That's because it is, and it's happening, and we're going to talk about it today. So stay tuned. In the United States, food companies are allowed to hire their own consultants to decide whether chemicals are safe to add to your food, and the FDA doesn't have to know about it. It's called the GRAS system, generally recognized as safe. Since 1958, an estimated 1,000 chemicals have entered the food supply through GRAS determinations made by manufacturers without any notification to the FDA. The agency only learns about these determinations if companies voluntarily choose to inform them, a system that began in 1997. Mitchell Cheeseman, former acting director of the FDA's Office of Food Additive Safety, explained the scope. Percentage-wise, flavors make up the largest number of GRAS ingredients in food. But here's where it gets concerning. The GRAS exemption was created by Congress in 1958 as part of the Food Additives Amendment. The idea was simple and reasonable. Common ingredients like vinegar, oil, and salt that had been used safely in food for generations shouldn't require the same rigorous approval process as novel chemical additives. But over the decades, the food industry expanded the definition of GRAS far beyond what Congress intended. Instead of limiting it to traditional ingredients with well-established safety profiles, companies began using the GRAS designation for synthetic chemicals and novel substances. And in 1997, facing budget constraints and limited staff, the FDA made a fateful decision. Rather than require companies to submit GRAS determinations for review, the agency proposed a voluntary notification program. Companies could inform the FDA if they chose to, but they didn't have to. This opened the door to what critics would later call secret GRAS determinations. Companies making their own safety decisions, hiring their own experts, and never telling the government. A 2013 study published in the Journal of the American Medical Association examined 451 GRAS determinations that companies voluntarily submitted to the FDA between 1997 and 2012. What researchers found was that financial conflicts of interest were ubiquitous. Of those 451 decisions, 22% were made by an employee of the additive manufacturer itself, another 13% by consultants hired by the manufacturer, and 64% by expert panels selected by manufacturers or their consulting firms. Not a single determination was made by an independent standing expert panel. Zero. The study found that 290 expert panels made GRAS determinations during this period, and a remarkably small group of individuals dominated these panels. One consultant served on 128 panels. That's 44% of all panels over 15 years. 10 individuals served on 27 or more panels each. At least one of these 10 frequent panelists was a member of 225 panels, representing 78% of all GRAS determinations reviewed. The study's authors used conflict of interest criteria developed by the Institute of Medicine. They looked at three factors: the likelihood that financial interests would unduly influence a decision, the seriousness of potential harm if decisions were influenced, and the extent of accountability. On all three measures, the current system raised red flags. The researchers noted that while the existence of a conflict of interest doesn't automatically mean decisions are biased, The concentration of determinations among a small group of industry-paid consultants raised serious concerns about the integrity of the process. The Government Accountability Office examined this system in 2010 and reached a damning conclusion. The FDA's oversight process does not help ensure the safety of all new GRAS determinations. The GAO report detailed multiple problems. The FDA had no way to track secret GRAS determinations. The agency wasn't monitoring whether companies were conducting appropriate safety reviews. And despite stating intentions to conduct random audits when the voluntary notification program began in 1997, the FDA admitted it had never actually conducted such audits. Now, the most terrifying part of the GRAS system isn't that these chemicals are unvetted, but it's that the FDA literally does not know they exist. Because notification is voluntary, what a company can do is create a synthetic preservative in a lab, name it generally recognized as safe, based on their own internal memo, which is secret, and put it on grocery store shelves tomorrow. When the FDA was asked in a government accountability report how many chemicals were in the U.S. food supply, they couldn't give a definitive answer. How comfortable does that make you? We are the only developed nation where the government is legally kept in the dark about the very ingredients they are supposed to be regulating. Again, how comfortable are you with that? The GAO made several recommendations: minimize conflicts of interest in GRAS determinations, require companies to notify the FDA of all GRAS decisions, issue guidance on how companies should document their safety reviews, and finalize the regulation for the voluntary notification program, which had been operating in proposed form since 1997. The FDA took some steps. In 2016, the agency finally finalized the voluntary notification rule. In 2022, it issued guidance on best practices for convening GRAS panels, addressing some conflict of interest concerns. But the fundamental problem remained: notification was still voluntary. Companies could still make secret GRAS determinations, and the FDA still had no comprehensive way to know what chemicals were being added to the food supply. In contrast, the European Union requires all food additives to receive pre-market authorization from independent regulators. Companies cannot self-affirm safety. Every additive must be approved by the European Food Safety Authority and the European Commission before it can be used. The difference in philosophy is stark. In Europe, chemicals are restricted until proven safe by independent authorities. In America, chemicals can enter the food supply based on company-funded safety reviews that the government may never see. In 2025, federal health officials began evaluating whether the self-affirmed GRAS pathway should continue to exist at all, marking the first serious reconsideration of the system in decades. The announcement cited concerns about transparency and the need for independent oversight. It marked the first time in decades that the federal government seriously considered closing what critics call the GRAS loophole. But whether this directive will result in meaningful reform remains to be seen. The food industry has long defended the GRAS system as necessary for innovation and efficiency. Trade groups argue that requiring pre-market approval for all ingredients would overwhelm the FDA and slow product development. Some legal experts question whether the FDA even has the statutory authority to eliminate self-affirmed GRAS determinations without new legislation from Congress. The 1958 Food Additives Amendment explicitly allows substances to be generally recognized as safe without formal FDA approval. And there's the practical challenge. An estimated 1,000 chemicals are already in the food supply through secret GRAS determinations. What happens to those substances if the pathway is closed? Does the FDA grandfather them in, require retroactive safety reviews, remove them from the market? The GRAS system reveals something fundamental about how America regulates the safety of its food supply. In an era when the FDA is stretched thin, monitoring everything from pharmaceuticals to medical devices to tobacco products, the agency has increasingly relied on industry self-regulation for food additives. The assumption is that companies won't jeopardize their reputations or face legal liability by marketing unsafe ingredients. That market forces and tort law provide adequate incentives for responsible behavior, but history suggests otherwise. It took decades for the FDA to address trans fats, even after scientific evidence mounted about their health risks. The agency's response to concerns about other GRS substances, from salt to certain food dyes, has been slow and often incomplete. The current system puts the burden on the FDA to prove a substance is unsafe, rather than requiring companies to prove it's safe before it enters the food supply. And when the FDA doesn't even know what substances are being added, that burden becomes impossible to meet. For now, an estimated 1,000 chemicals are in your food that were never reviewed by the FDA, approved by consultants who were paid by the companies that make them. Whether 2025 marks the beginning of real reform or just another chapter in the long debate over food safety regulation, only time will tell. Now, before we end this video, I want to put a little bit of context to the GRAS system in and of itself. In its inception, it was meant for good, and it worked extremely well. But that's not what we have today. What we had from its inception is far different from what we have today. Originally, what it was meant to do was to account for the ingredients that our parents and our grandparents used, which were simple ingredients: salt, vinegar, pepper, just regular ingredients, not chemicals with names that we can't even pronounce. That's not what it was meant for, but that's what it has morphed into. So we're dealing with a completely different animal than what we did 50 years ago. And so we have to make adjustments to account for that. The system in and of itself needs regulation, plain and simple. And until that happens, we as consumers have to be smart about the things that we consume. It's on us because it is our health. Because the companies that are putting these things in our grocery stores, their bottom line is their profits, not our health. Our bottom line is our health and not their profits. So if we're going to consume these things, we need to be smart about what we're consuming. We need to learn to read the ingredients and how these things that we are consuming is going to affect our health. So part of my mission and this channel is to just bring these things to light, but not only that, more importantly than just bringing them to the light is to let you know what you can do about it, how you can protect your health and your family's health so that you can live longer without living your life in the hospital or on medications. And if you're north of 50 years old, like I am, then you have work to do. But the good news is that these things are fixable. These diseases that we are dealing with is fixable. Our body has an incredible ability to heal itself if we feed it the right foods and avoid certain chemicals. And we talk about all of these things and much, much more in the MAP 30 Challenge. And you can find the link for that in the description if you want to take a look at it. I really appreciate your time. Thank you for watching. We will see you in the next video. Bye for now.